Hi everyone, welcome back to the episode of Ask Dr. Nick. My name is Dr. Nick Schmidlkoffer and I work for the Neurologic Wellness Institute. And today's question is, what is brain fog? And this is something that's kind of a mystery. Brain fog is this new term that it's more of a colloquial term rather than a scientific term. But more doctors, more neuroscientists are starting to recognize brain fog as a true symptom and a symptom of many diseases or many complications. Brain fog can occur with concussions, with chronic fatigue syndrome, with nothing else, with just general, neck, back pain, just going through daily living and just having, brain fog after a long day's work, or brain fog after eating a certain food with food sensitivities, having gut problems, other bacterial or microbiome dysbiosis problems. And so brain fog is the topic of today's discussion because it is commonly a brain problem, but it can be influenced by many other factors, as I was just saying. And so we're going to look at a paper that talks about how brain fog is associated with chronic fatigue syndrome and where are the true origins of that brain fog. And they like to look at blood flow and see, is there enough blood flow getting to the brain, especially the areas for executive and cognitive function. And this can be determined in multiple ways. So let's take a look at this paper. So this is from Frontiers in Physiology. It's from April 2013, so a relatively older paper, but it's called Caught in the Thickness of Brain Fog, Exploring the Cognitive Symptoms of Chronic Fatigue Syndrome. So we'll look right at the abstract here. Chronic fatigue syndrome is defined as greater than 6 months of persistent fatigue that is experienced physically and cognitively. Most people with chronic fatigue syndrome say they have brain fog. Brain fog is slow thinking, difficulty focusing, confusion, lack of concentration, forgetfulness, or a haziness in thought processes. So basically, some people describe brain fog as in their brain just feels like they're on fire or foggy, not able to think, or just this really hard ability to think and focus on something. So possible correlations, this is the important part here, is that chronic orthostatic intolerance, so orthostatic meaning sitting upright or standing up straight, in the form of postural tachycardia syndrome, or POTS, postural orthostatic tachycardia syndrome, and decreases in cerebral blood flow. So there's been fMRI studies that showed this, so on and so forth. And then here, thus, the cognitive symptoms of chronic fatigue syndrome may be due to altered cerebral blood flow activation and regulation that are exacerbated by a stressor, such as orthostasis, sitting up or standing up for a long time, a difficult mental task, resulting in decreased ability to readily process information. And then this is perceived as fatiguing and experiencing of brain fog. So this is the main point here, is that brain fog is probably due to something where it's a lack of blood flow to those areas of the brain, lack of shunting blood flow. So this is a form of dysautonomia, or a problem with the autonomic nervous system getting blood flow into those parts of the brain. So, real quick, just want to talk a little bit about that chronic fatigue syndrome. So it's a new onset, non-exertional, not improved with rest, and it debilitates a person's lifestyle. They must have at least 4 of the following: pharyngeal pain, cervical or axillary lymphadenopathy, or too many lymph nodes that are tender, inflamed, myalgia or muscle pain, polyarthritis, so arthritis or joint pain, edema, headache, non-restful sleep, prolonged exercise fatigue, and or debilitating cognitive impairments and short-term memory and concentration. And so this is what chronic fatigue syndrome needs. These are the main symptoms. And then brain fog, again, is slow thinking, difficulty focusing, confusion, lack of concentration, forgetfulness, haziness is a thought process. That's the brain fog aspect. So if we look at this photo here, this figure, we see that Alterations in cerebral blood flow regulation are associated with orthostatic intolerance, or POTS, which is a form of dysautonomia, and these two have altered cerebral activation to a stressor. So cerebral meaning our brain, and so we are getting a lack of blood flow to the parts of the brain that need it, maybe during a stressor. That stressor, like you said, could be sitting up straight. It could be just a difficult mental task, a cognitive task, whether that task is tracing dots or thinking of making a couple decisions about what we're going to eat for breakfast or lunch or dinner, determining proper order of things, like I need to go to the grocery store, pick up the kids, and then come home. So all of this can be too much of a stressor. We're not getting blood flow to the brain that is necessary, which then leads to cognitive impairments and a perception of this mental fatigue. These two together is what gives the brain fog symptoms, or symptoms of chronic fatigue syndrome. And so the key is to improve blood flow regulation and improve the body's ability to withstand these stressors of orthostasis, or sitting up straight, standing up straight for a long period of time, to get blood flow to the areas that need it. So that's the basis of this. They have a lot of other parts about orthostatic stress impairs cognitive performance. We know that with POTS and dysautonomia, people have chronic fatigue with that. Psychiatric comorbidities, okay, are fairly common with chronic fatigue syndrome. Cerebral blood flow is decreased in chronic fatigue syndrome. So again, just more evidence showing that there's a lack of blood flow, and that lack of blood flow can be causing brain fog symptoms. Physical and cognitive symptoms of chronic fatigue syndrome may be a mental perception, okay, of the stimuli. How that functional MRI shows regional blood flow alteration or activation, and the experience of brain fog in chronic fatigue syndrome as a collection of these physiological, cognitive, and perceptual factors. So basically, we know that there are these cognitive impairments may be associated with impaired cardiovascular hemodynamics, like seen in POTS, with decreased total cerebral blood flow activation, altered activation of cerebral blood flow during mental tasks. Okay, so to date, this is the important part, the last paragraph. The treatment of chronic fatigue syndrome has been focused on improving the physical fatigue state rather than the cognitive impairment. Meta-analysis demonstrate that cognitive behavioral therapy and graded exercise therapy effectively treat chronic fatigue syndrome in individuals. Okay, so here, let's go back. Basically, chronic fatigue syndrome, people have been focusing on that physical exhausted state. We're not looking at the cognition, okay? So a lot of times what we do here in the clinic is people with brain fog, chronic fatigue syndrome, we activate their brain through bottom-up mechanisms such as physical exercise, physical movement, okay? But while they're doing a mental task, while they're doing a cognitive task, a decision-making task, a simple short-term memory task, something that is going to involve two parts of the brain, the proprioception, the body-up activation from the vestibular system, the body, and then also the top-down from the cognitive centers in the frontal lobe and other areas of the brain. And so these two connecting together is what's going to help to increase blood flow to the brain. And then increasing blood flow to the brain is going to help to improve those neurons, improve those brain cells that are involved in these mental tasks. That will eventually, over time, build up this stamina to be able to walk around a city all day with friends and family and not feel this brain fog fatigue because of this orthostatic or being up for so long, or the mental stress of sitting at a computer all day and doing something for work. So the key is to improve the brain from multiple mechanisms and get blood flow to those areas of the brain. And some people who are very low, very involved in this chronic fatigue, they are going to be maybe needing more care with POTS and dysautonomia, rather than integrating so much right away with these complex tasks. So I hope this was a good one. I think brain fog is relatively common nowadays. Like I said, always check for food sensitivities as well. But if If you have any questions or comments, please leave them below. If you have any suggestions for future topics, I would love to hear them. Thanks again, and have a great day.